Welcome to the Healthy Matters Podcast with Dr. David Hilden, primary care physician and acute care hospitalist at Hennepin Healthcare in downtown Minneapolis, where we cover the latest in health, healthcare, and what matters to you. And now, here's our host, Dr. David Hilden.
Hey everybody, it's Dr. David Hilden, your host of the Healthy Matters podcast, and welcome to the show. Today, we are going to talk about multiple sclerosis. It's an illness that many of you maybe have heard of. Maybe you even know somebody or have a loved one who is living with MS, but do you really know what it is? Today, I invited a colleague of mine at Hennepin Healthcare in downtown Minneapolis, Dr. Ali Al-Momen. He is a neurologist and a physician who treats and diagnoses multiple sclerosis. Ali, welcome to the show.
Thank you so much.
It's great to have you here. If you could just start right out for us. What is multiple sclerosis?
So multiple sclerosis is an immune-mediated inflammatory disease of the central nervous system. When you say immune-mediated inflammatory, it means like the body is attacking itself and affects part of the central nervous system called the white matter predominantly. So what is the white matter of the brain? So the brain is divided into gray matter and white matter. The gray matter has these cells of the brain called neurons, and then they have these cables or axons that are covered by something called myelin, so which is like the outside covering of cables. And by attacking this myelin can cause like different manifestations and different symptoms. So it can affect your brain, your spinal cord, and the covering around part of your eyes called the optic nerve.
So this myelin, I like that description. It's like the covering of a cable.
That's what it is.
I really like that.
Yeah.
And that's the white matter. And apparently it's quite important for your body's neurologic function, right? What exactly does this myelin do?
So basically, the way your brain communicates and your nervous system communicates, it sends signals through these cables. And if these cables are damaged, the signals are not sent properly and can lead to problems and dysfunction because of that.
Okay, so that's the basic thing, is that your body's attacking the white matter of your central nervous system, the covering on the cables, the myelin. I really do like that. So do we know what causes it?
We're not 100% sure exactly what causes it. There's different theories on what's causing it. One of the theories is it's something called a common virus in the population that affects like 80-90% of people, called Epstein-Barr virus.
Epstein-Barr?
It's a common virus.
That's everywhere. Epstein-Barr virus is everywhere.
Yeah, exactly. So like 80-90% of people have it. But in some people, it's thought to be involved in triggering this immune attack. So there was a study done at the VA, and they noticed that pretty much everyone who had MS had Epstein-Barr. And the people who weren't initially diagnosed with Epstein-Barr and developed MS ended up having Epstein-Barr. So there's association with that.
But not everybody, because like you just said, 80% of us have Epstein-Barr virus, and 80% of us do not have MS.
Yeah. So there's other theories. One of the theories is, for example, like vitamin D being low is involved in, like, for example, Epstein-Barr immunity and some of our immune signaling pathways. So that's one of the other theories. But like, we don't know exactly 100% the cause. Like, even in terms of genetics, like even if you're identical twin, the chances of you getting MS if your twin has like 30% still. So
and you shared your DNA, so
exactly.
That's interesting. So what literally is happening to that myelin, that sheath over the nerves? What's happening to it in MS?
So there is inflammation. So we have these different cells involved in our immune system. So there's things called B cells, T cells, and microglial cells. So these cells are causing inflammation. Okay, so they trigger release of inflammatory molecules, and this leads to damage to these cables or myelin sheath.
Let me shift to how someone might know if they have it. What are the symptoms? How does somebody know?
That's a good question, but it's also a tricky question. The reason being is the central nervous system can lead to many different manifestations. So,
like if the main processing computer of your body isn't working right, lots of stuff can happen.
Exactly. So it's kind of a tricky question because there's a lot of different things that can present. And I think it's part of what you need is to talk with your physician to try to clarify what's going on. Because For example, one of the most common things that people present with is like they can have what we call sensory symptoms. So people can have like numbness, tingling, feeling weird sensations in their body. But there's also different common causes of those symptoms more than multiple sclerosis.
You can get numb fingers for a lot of reasons.
Yeah, so people can have like pinched nerves or neuropathies, which may be more common than multiple sclerosis. So that's one of the common manifestations. The other common presentation is it sometimes can cause inflammation of the what are called optic nerve. So people can present with something called optic neuritis. So people can have pain with the eye movements as well as vision loss and problem with seeing colors. So that's one of the, for example, classic features of multiple sclerosis. If it sometimes affects, for example, your spinal cord, people can have numbness, problems with weakness, problems with controlling their bowel, bladder. Another common symptom is just being fatigued. So it's kind of a tricky thing because a lot of the symptoms can be from many different things and they have a lot of different causes. But if you have to think about things in the context and in the right age, and if there's many different symptoms that don't really fit or localize well, that's something to think about.
When you get any of these symptoms, and you literally mentioned like everything that a nerve controls in your body, which is your whole body.
Yeah.
If it's in your eyes, that you get visual problems. If it's in your fingers or your toes, you get numbness there. You can get weakness. You get bowel problems. So you pretty much say like everything in your body that's controlled by a nerve. When the symptoms come on, do they just stay? Do they get worse and worse and worse? And how quickly does all that happen?
That's a good question too. It also depends.
Yeah.
So when we classify multiple sclerosis, there are two main classifications that we use when people are diagnosed. There's something called relapsing remitting multiple sclerosis, which is the most common type at diagnosis. So 90% of people have that. And there's something called primary progressive multiple sclerosis, which 10% of the people have.
Just 10?
Yeah, 10% people present initially as. So when people have these relapses, we define a relapse as having a new neurologic symptom that lasts more than 24 hours and is outside the setting of like fever. So some people can have that attack last a week, for example, and then they recover. Sometimes they recover completely.
The symptom will just go away.
Yeah, sometimes it goes away. That's why sometimes it's kind of hard to get the diagnosis. Yeah. People say, I just had numbness here. It just went away after a week. I didn't pay attention to it. And then they have another attack like a couple of years later. And then, there's something going on. And then they seek medical attention at that time. So sometimes it goes away. Sometimes it does leave like permanent problems. So let's say you had an attack, your left arm was weak and numb. Sometimes it just stays permanently. And in the primary progressive form, there isn't per se a clear-cut attack. It's more just chronic worsening of symptoms. Like chronically, your left leg continues to get weaker, number.
Yes, more primary progressive.
Yeah.
So relapsing remitting. Primary progressive. They both sound like it's over a long time, though. These symptoms might be going on for years before someone even knows they have it.
Yes. The primary progressive, actually, the diagnosis requires you to at least have a year of symptoms.
A year of symptoms before you can even make the diagnosis.
Yeah. In terms of the relapsing or remitting, like I can say it's variable, but also the term is kind of a misnomer because people can have neurologic inflammation and changes on MRIs that they're just noticing because not in a critical area.
So those are the two primary kind, and it sounds like you can have MS for a while before you know that you do. When do people come to see like a specialist like you? I assume that people are going to their doctor, they're telling them these symptoms. What does the typical patient look like that gets to you? Have they already been trying to figure out their symptoms for a long time?
Yeah, I think most of the referrals, by the time they go to get to MS specialists, is usually they have an MRI that's done.
Somebody got an MRI.
Yeah, and the MRI looks like what MS looks like.
So you can see it on an MRI.
Well, it's kind of tricky too, but like it looks a certain way on MRI. It's like the lesions look kind of like a circular, and they're around certain areas.
Yeah, it's interesting. You know, the brain and the central nervous system is so amazingly complex, and we know so much about it, and some things we don't know so much about. But I'm always amazed that you can pinpoint exactly where the problem in someone's brain is, and then maybe one day we'll figure out what actually causes this so we can get down to the root cause of it. I'm going to talk about that a little bit later. Let's talk about how common MS is.
It's around 1 million Americans have MS.
And that's a lot.
Yeah, it is a lot. It's actually the most common disease causing inflammation in the brain is multiple sclerosis. There are other rare conditions, but in terms of inflammatory diseases of the brain, it's the most common, and it's the most common cause of neurologic disability in young adults in terms of things like mobility, separate from traumatic brain injury.
So you said young adults. Is that who it hits the most? What's your typical patient, or in whom is it most common?
So an average age range of around people getting diagnosed is around 30.
30?
Yeah, but it can happen when people are young and can also occur when people are older. It's slightly more common in women than men. Like many autoimmune conditions, like women have it 2 to 3 times more likely than men.
I've heard that a little bit over the course of doing these podcasts for the last 4 seasons. We talk a lot about autoimmune illnesses. A lot of human conditions are caused by your immune system attacking itself. But it seems to be more women than men in some of them, and younger women. 30-year-old women. We did a show about lupus, too. So listeners, listen to the show about lupus. That is more common in young women as well. Do we know why that is? Why would it be women more than men?
I think I've read that the women have an X chromosomes, and the X chromosome is involved in like the workings of the immune system. So just having that X chromosome predisposes a lot of women to having more immune conditions.
I'll bet there's loads of people doing research on the genetic origins of things like MS. What about geographically? Does that make any difference, or is it just as common worldwide or in this country? Does that not matter?
So geographically, the thought is it's related kind of to UV light exposure and like vitamin D. It's thought that the more north or south from the equator, more likely to get multiple sclerosis.
Because of UV light. So in Minnesota, I know several people who have MS in my personal life and obviously in my clinical practice. So we're sort of in that, we're in the northern half of things. So Minnesota might be a place where we see more. But that's interesting. If you live in equatorial places, it's maybe not quite as common because UV light is protective. Is that what you're trying to say?
Yeah.
Wow.
Well, it's kind of tricky too, because now we're studying like the epidemiology of multiple sclerosis, and they found that it's like more common in Black populations, Asian populations than we previously thought. So it's something that's also being studied.
What about your family history? Is it genetic? I mean, do you get it if your folks had it?
So there is, like I said, there is that risk. So like if you're twins, you have a 30% risk, but it's not 100% guarantee. So if you have family members that have it, that increases your risk of having sclerosis, but it's a mix of environment, triggers, and family history. So there's no guarantee that there's no like one gene. Hey, you have this gene, you're going to have multiple sclerosis.
When we come back from the break, I'm going to talk a lot more about the impacts on people's lives and treatments and how people are living with MS, because lots of people are living with MS. But before I do that, I want to talk just briefly about diagnosis. You've touched on it, MRIs, and I think it involves going to a smart neurologist like you. But how do you diagnose it definitively?
So the diagnosis is not, what we use is something called the McDonald criteria.
McDonald?
Yeah. You need to have clinical symptoms that fit with multiple sclerosis, okay? And then you need to have supportive evidence of MRIs showing that where the lesions are, and they need to be what are called disseminated in time and space. So we look at where the lesions are on MRI. We look if they're picking up dye or not. And the other thing we sometimes use to help make the diagnosis is a spinal tap. So when we do a spinal tap, which is taking fluid from your back that tells, and this fluid is what circulates around your brain, we sometimes see signs of inflammation in 90% of multiple sclerosis patients. So that's something we use as a supportive of the diagnosis.
You don't do that spinal tap in everybody?
No. It's sometimes you can meet the diagnostic criteria without a spinal tap, but in certain cases we're not sure, or you need to help confirm the diagnosis, you do the spinal tap.
Terrific. We've been talking with Dr. Ali Al-Momen, who is a neurologist in Hennepin Healthcare, and we're talking about multiple sclerosis. After a short break, we're going to discuss treatment options, and I do want to ask Dr. Al-Momen, how do people live with MS and the effect it has on people's lives? Stick around. We'll be right back.
When Hennepin Healthcare says we're here for life, they mean here for you, your life, and all that it brings. Hennepin Healthcare has a hospital, HCMC, and a network of clinics both downtown and across the West Metro. They provide all the primary care and specialty care you would expect to find. But did you know they also have services like acupuncture and chiropractic care available at many of their primary care clinics and at their integrative health clinic in downtown Minneapolis? Learn more at hennepinhealthcare.org. Hennepin Healthcare is here for you and here for life.
And we're back talking about multiple sclerosis, otherwise known as MS, with Dr. Ali Al-Momen from Hennepin Healthcare. He is a neurologist and an expert in this condition. So in the first half, Ali, you talked about lots of symptoms, and it struck me as I've had a lot of those. And I bet people listening will say, well, I had a numb foot one day, or I don't know, my vision was a little bit cruddy one day. It went away. That's kind of scary because they can be due to lots of other things too.
I definitely agree, and that's part of what makes it kind of tricky. So I think one of the important things is just work with your physician if you ever have any new neurologic symptoms or vision symptoms or concerns to get evaluated, because that can help identify what the problem is and to evaluate and rule out other conditions and get you on the right track in terms of a diagnosis.
Sounds good. Now I want to talk about people living with MS, treatments, and what life is like. So I'm just going to ask you a straight up question. Can people live a normal life if you have multiple sclerosis?
Yes, you definitely can. And that's something that's kind of tricky about this. Like I mentioned, there's 1 million people with it. So it's more common than people think. There's so many people that you'll see walking in the street and look relatively normal, and they have multiple sclerosis. One of the segues in terms of this is I think the disease in terms of management has significantly changed in the past 20 years. 20 years ago, we only had 3 drugs.
When I started practicing, there were about 3 things. I didn't prescribe any of them because I wasn't a specialist, but there wasn't a ton.
Yeah, and now there's more than 20.
More than 20. See, the last 20 years have been really an amazing couple decades of. I'm sure the previous 20 were as well, but I've been practicing over 20 years, and we didn't have hardly anything. So these medications, let's get into that a little bit. What kind of treatments are available?
So in terms of treatments, the way we manage the disease is what we call disease-modifying therapy. So there are medications that we use that work on your immune system, and that helps with reducing the inflammation related to the disease. But as the way they work, they also make your body more prone to having things like infections. One of the worries we have is slightly increased risk of cancer because your body's...
Because it's messing with your immune system.
Yeah, your immune system is important to survey your body for things like cancer.
It'd be great if there were a medication that tamped down your immune system only related to where it's messing up, like on the MS thing and the demyelinating of your nerves, but it doesn't affect the rest of your immune system. But I bet that's a little bit harder in medications.
Yeah.
Just target it to the right part of your immune system.
Yeah, that is tricky. Yeah. It'd be nice to have a holy grail like that, but unfortunately, we have, for example, the way we're approaching the meds right now is some people, I think most MS providers right now are going to call high efficacy route. So they're using more aggressive medications early on to hit the disease early on to prevent further disability in the future. But we have some of the older medications. One of them is called letermirastate or Copaxone. That one doesn't tamper with the immune system as much, so it has less of those side effects, but it's slightly less of an effective medication because of that.
When you start people, you said you treat high-efficacy drugs early in the disease. So that implies to me that it does matter then that you get at it as soon as possible?
That is for sure, yeah. So that's something we're currently also studying right now. There are some trials to see what's the right way to treat this. So
not sit around and wait 10 years until it gets bad.
Exactly. So previously, what people used to do is put you on the safer medications, and if you start having attacks, more MRI activity, they'd switch you to more effective medications. But nowadays, a lot of MS physicians tend to start people on higher efficacy, stronger, more effective medications, as some of these patients have less disability, less MRI activity in the future. And we hope in the end that helps overall with the prognosis for the patients and preventing disability for them in the future.
Are there things people can do that are not the medications that you prescribe to slow down progression? Is there anything we know that in your lifestyle, here's what you ought to be doing?
Yeah, so the things that are important is just one of the things you can do that's very important for your health in general is, for example, smoking. Smoking can worsen inflammation. Smoking can make MS progression worse. And quitting smoking is one of the best things you can do for your health and multiple sclerosis. But also just having a healthy lifestyle in general, healthy diet, healthy weight, controlling your risk factors for example, having stroke, because a lot of what happens when people get older is they can have also damage to the same thing, that what we call the white matter, from having high blood pressure, diabetes, high cholesterol, those cause kind of silent strokes. And that also contributes and confounds multiple sclerosis when people are getting older.
Those are good tips. And regular listeners to this podcast will know that if you haven't learned yet that you're not supposed to smoke, I encourage you to listen more carefully. You should not be smoking. I have a question about those nerves themselves. And since I got a neurologist here and I've got you captive right here in the studio, do nerves heal? And then like in the MS specifically, or just in generally, they're demyelinated. The sheath, the cable is damaged. The nerves are damaged here. Do they ever heal again? Or are you just trying to prevent future nerves from being damaged?
There is possibility of, if it's just the cable that's damaged, that can heal up potentially.
They don't heal quickly, do they?
They don't heal quickly. It doesn't heal quickly. But sometimes the inflammation is a lot and you can have like permanent damage to the cable itself, or what we call axon loss.
Axon loss, okay.
Yeah, so sometimes you can heal a bit, but it doesn't heal perfectly sometimes either. Sometimes the damage is permanent.
I've often wondered that about the human body, and I'm not expecting you to actually have an answer to this, but you cut your skin and 2 days later, it's healed. And many things in our body, your liver can practically regrow itself, but your nerves don't. They just don't. They're so dang slow in healing. And I know everybody with spinal cord injuries and brain things and immune damage from things like MS know that full well, that your nerves just take forever to heal when they're able to. Let's talk a little bit about the lives people live. What types of support systems are important for people living with MS, particularly if it has led to some disability, either physical disability or mobility, things like that?
So I think it's always good to have family around you, especially if you're having, it's not just, for example, like the physical toll and things. Sometimes when you have disabilities from things that can have an emotional toll as well. So having family to support you both in the physical and mental toll of things is very important. We also have, rely on different specialists like physical therapy, occupational therapy to help people, help manage their symptoms, help them adapt better, walk better, use their hands better if that's affected.
Are there resources for like support groups? I know there's the MS Society, is there not?
Yes. So what I recommend,
are they still out there?
Yeah. What I recommend people to look into is the National MS Society website. That's the main American multiple sclerosis website. It's a very helpful website.
One thing we try to do in this podcast is get people to reliable, accessible information. Yeah. I know they're getting it from this podcast, but on the internet, so much of what's out there is just garbage. But the MS Society is not. It's reliable, correct?
Yeah, so I recommend patients look at the National MS Society website. It's very helpful. It has a lot of information. It has information worded in a nice way. It has FDA labels for medication, and even has social workers available on the website that you can access. They're called MS navigators. And when people have initial MS diagnosis, it also has very useful information and also links to support groups and whatnot.
And we can get a link to the National MS Society on the show notes for this podcast. So listeners, you can look where you access the podcast. We'll put a link right to the MS Society page there. Let's talk about the future. So there's lots of new medications that we have now, and it makes it a completely different landscape than it was 20 years ago. Okay, go 20 years into the future now. What is some of the latest research looking like for MS?
So one of the things, remember we talked about the McDonald criteria?
Yeah.
So the last time it was updated was 2017. We're actually going to update it this year. The new updates will hopefully make it easier to make an earlier diagnosis. And there's one thing I didn't talk about. You asked how long do you have someone have multiple sclerosis without knowing it? Sometimes we get MRIs on people who have headaches, head trauma, and it looks like multiple sclerosis, but the person didn't have any clinical symptoms.
Yeah.
That's something called radiologically isolated syndrome. We're not sure what to do for
what to make with that. You got an MRI for another reason. You saw this thing.
Yeah. So hopefully the new guidelines will shed light on how can we diagnose people with multiple sclerosis and how to put these people on medications.
Even before you maybe are having some symptoms.
Yes. Yeah. So the goal is to have an earlier diagnosis. The other thing that's big into clinical trials right now, which is the way pharma companies test new drugs, is There's a new class of drugs being tested called protein tyrosine kinase inhibitors. It's used in...
Easy for you to say.
Sorry, yeah. It's used...
Could you say that again? What are they called?
Protein tyrosine kinase inhibitors, BTK inhibitors. They're used in like other fields, like for cancer. And these drugs are currently being studied for multiple sclerosis, and we're expecting results of the newer clinical trials soon, and we'll see if these drugs can get into the market.
Yeah, I just hats off to the research community. We have a big research community at Hennepin, but for all those researchers around the globe who are working on MS, there's some optimism that there's some new things coming down the road, and there's not a cure, though, is there?
Unfortunately, there's no cure yet. That would be amazing, but unfortunately, we don't have a cure. These medications, what they do is they reduce inflammation, they reduce MRI activity, but it doesn't remove the inflammation process completely. There's no complete cure for the disease.
Just to stop it and be done with it, yeah.
The medications don't reverse whatever damage that's been done prior to the medications. We don't have specific medications to do that yet. That's something that's also being looked into, but we don't have specific medications to repair those cables or myelin.
Yeah, maybe someday down the road. People don't often understand that, but it's something that took me maybe a decade or two to learn, is that much of medicine doesn't have a cure. Much of what I do, very little of what I do in internal medicine has a straight-up cure. I guess strep throat, we can cure that with penicillin. But heart failure and high blood pressure and diabetes and all the other specialists I have in the show, and in this case, multiple sclerosis, it does not mean there aren't treatments, though, to make it so that you can live your life, lead a normal life, and do all the things you want to do, even in the absence of a cure. So sometimes people get kind of depressed when they hear, there's no cure. Maybe not. But there are effective treatments to allow you to live a fulfilling, satisfying, long life with many of these things, including MS. Thank you for being on the show today, Dr. Al-Momen.
Thank you.
It's great to have you, Ali. We've been talking with Dr. Ali Al-Momen. He is a neurologist at Hennepin Healthcare. We've been talking about multiple sclerosis. And just know that there is help available. There are treatment options. It's getting better every day, and there is hope for the future. Be sure to check us out in 2 weeks' time for our next show. And in the meantime, be healthy and be well.
Thanks for listening to the Healthy Matters Podcast with Dr. David Hilden. To find out more about the Healthy Matters Podcast or browse the archive, visit healthymatters.org. Got a question or a comment for the show? Email us at healthymatters@hcmed.org or call 612-873-TALK. There's also a link in the show notes. The Healthy Matters Podcast is made possible by Hennepin Healthcare in Minneapolis, Minnesota, and engineered and produced by John Lucas at Highball. Executive producers are Jonathan Comito and Christine Hill. Please remember, we can only give general medical advice during this program, and every case is unique. We urge you to consult with your physician if you have a more serious or pressing health concern. Until next time, be healthy and be well.